President Trump noted mild swelling in his lower legs. This concern was thoroughly evaluated by the White House medical unit. The president underwent a comprehensive examination and revealed chronic venous insufficiency, a benign and common condition, particularly in individuals over the age of 70. Importantly, there was no evidence of deep vein thrombosis or arterial disease.
Caroline Levitt, you saw that right here live on Newsline, talking about diagnosis of the president. Let's bring in now Dr. Chauncey Crandall, the director of Palm Beach Clinic of Preventative Medicine, as well as cardiology, and the editor of the Heart Health Report. Dr. Crandall, welcome in. It's good to have you with us.
Thank you, Bianca.
All right, so the White House says it is benign, but what can you tell us about this condition President Trump has? How common is it, and what should people know?
Well, venous insufficiency is very common, Bianca, as someone ages, especially his age. He's almost 80. And the veins in the lower legs get tired, really. But the reason is that the veins have little valves in there, and they become dysfunctional. They don't work correctly. So often fluid will collect in the lower limbs and the feet. This does not mean that you're going to die. You're not going to have a stroke or something like that. But it's a fairly benign condition. Often it can be managed with compression stockings or maybe even a mild diuretic. But I would like to point out that President Trump is a little different than other 80-year-olds. He's almost like a bulldog. He has great endurance. But Bianca, he is in the plane in and out every single day almost. He probably flies more than anyone else. And you know, and many of the people watching know, that when you fly in a plane, you collect fluid in your legs. It's because of the change of the cabin pressure. And I think this is really what's causing the president's problem. No one's picked up on it. It's simple. It can be corrected easily with the compression stockings, lower salt diet, things like that.
Yeah. And you're right. He is all over the world and then back doing his job here at home as well. So incredible insight there. I do want to talk about the article on Newsmax.com you wrote. It is about stroke, and you cite a study in the journal Neurology. And this is, if you're depressed, you may have a 46% greater risk of stroke. That's a pretty high number, Dr. Crandall. What do we do?
Well, you got to get out of depression, and depression is something that usually lasts longer than 2 weeks. If you have a family member that's depressed, get them up, get them active, get them out, have them get on a better diet, lose weight, be in a social circle. This will help them get out of the depression. But depression is always associated long-term with bad lifestyle, bad eating, bad activity, bad weight, these type things. So this can really impact you, and you can have a difficult time going forward. So let's move and get over it.
All right. It is great advice, as always, Dr. Chauncey Crandall. I appreciate you. Thanks, and enjoy the rest of your day. We'll see you back here soon, I hope.
Thank you, Bianca.
And there is help for people. The Christ Cure, a Faith Foundation guide, a book. If you're dealing with depression, you can get this book and Dr. Crandall's Heart Health Report, a free offer. Call or go online and check it out right now.
Information. Truth is freedom. Is Newsmax. It's real news for real people.